Hey everyone, I'm Dr. TJ An. Quick question, and be honest with me. Have you ever not recommended your best treatment because you're afraid that patient would think you're just trying to make money? Maybe you knew a cash pay option would actually solve their problem, but you defaulted to whatever insurance would cover instead? Yeah, I've been there too. But here's what I finally realized. If you truly believe in your treatment, if you know it works, then not mentioning it only because it is not covered by insurance isn't being humble. It's actually being negligent. That's what I call ethical persuasion. And it's one of the core pillars of how I help doctors design outcome-driven treatment packages that are independent of insurance. So before we dive in, if this kind of content is helpful, go ahead and hit that like button and subscribe. It helps more private practice doctors find these type of strategies. All right, let's talk about why charging cash might be the most ethical thing you can do. We've been conditioned to believe that insurance equals ethical care. But let's be honest, the insurance model rewards value, not results. Patients don't always get the best treatment. They get the one that's covered. But that's not ethics. That's bureaucracy disguised as care. If insurance dictated ethics, then every denied claim would be a normal judgment, and we all know how ridiculous that is. So let me ask you, have you ever had a treatment denied that you knew was the right call? So drop a comment and tell me what specialty you're in. I'm just curious how widespread this really is. Here's the shift I made in my practice, and it changed everything. I stopped building treatments around coverage and started building them around outcomes. I focused on what would actually solve the patient's problem, not what some insurance company approved. Once you truly believe in that treatment, you have a moral responsibility to explain it clearly and help your patient make the right choice. That's ethical persuasion. It's not manipulation, it's a clarity with compassion. So let me give you an example from my own experience. I'll never forget this one. One of the first times I recommended a comprehensive pain treatment package, it was $2,400 instead of insurance covered option. My hands were literally sweating and I thought, is this ethical? Am I being greedy? But you know what? That patient is now pain-free and sent me a thank you card 6 months later. The insurance option, it would have been maybe 12 visits of temporary band-aids. So here's how I think about it now. Closing isn't about pushing. It's about closing the gap between a patient's pain and their solution. If you know your treatment can fix their problem and you don't help them say yes, again, that's not humility, that's a negligence. Question for you. Have you ever had a patient come back and thank you for recommending something insurance didn't cover? I'd love to hear that story, so leave a comment below. This isn't just podiatry, by the way. This applies to every specialty. Let's say if you're a podiatrist offering minimally invasive surgery that gets patients walking again without pain in days instead of months. That's not luxury. That's responsible medicine. Dentist recommending, let's say, dental implants that restore function and there's confidence in smile of patient. That's integrity. Dermatologists with laser treatment that actually heals scars instead of just covering them up. Chiropractor or physical therapist offering a program that fixes the root cause instead of masking symptoms with endless adjustments. Again, that's what good medicine looks like. See the pattern? Ethical persuasion means presenting the best solution, not just the covered one. Here's the thing. Patients look to you for leadership. They don't want a menu of options. They want direction. When you stand behind your recommendation and communicate it with confidence, they feel safe saying yes. That's what leadership looks like in healthcare, not hiding behind coverage rules. The way you communicate in these moments matters. How you ask questions, how you present value, and oh, by the way, this is huge, when to stop talking. I actually made an entire video on this called Strategic Silence, the power of shutting up during consultations. If you haven't seen it yet, I'll link it at the end of this video. It's one of the most underrated skills in private practice. Coming back to ethical persuasion. So a lot of doctors still feel guilty charging cash. But charging cash isn't unethical. It's sustainable. It's what allows you to keep offering world-class care without burning out. Ethical persuasion protects both your mission and your profit margin. Because here's the reality. If you can't keep the lights on, you cannot help anyone. So here's my question to you. What's the biggest mental block you have around offering cash pay services? Is it fear of rejection? Maybe guilt? Not knowing what to say? Tell me in the comments. I want to know what's holding you back. If you want to master this framework in a structured way, the exact consultation process, the package design, the ethical closing techniques, I teach all of it inside my Profit Alchemy program. It's the same system I used to help doctors double their profits in 60 days by building hybrid concierge treatment packages and learning how to guide patients ethically say yes. So I'll drop a link below if you want to check it out. And if you want to go deeper on that consultation skill I mentioned earlier, which is strategic silence, I'm putting that video right here. It's a game changer for closing without feeling pushy. So go watch it after this one. Again, to recap, ethical persuasion isn't about selling, it's about serving with confidence. The most ethical doctors are the ones who guide patients to make the best decisions for their health, regardless of what some insurance company approves. If this message resonated with you, do me a favor, hit that like button and subscribe to my channel and turn on notifications so you don't miss next week's video. I'm Dr. TJ An. Thank you for watching, and I will see you in the next one.